The next medium and small vessel vasculitis is Kawasaki's disease. Kawasaki's disease presents or emerges as an acute systemic disorder, febrile illness, usually affecting children which are less than 5 years of age, and it is a vasculitis that usually affects the coronary vessels. So thus the patient can present with ischemic heart disease at a very young age, since this affects the children under 5 years of age. Kawasaki's disease is usually found in Japan, China, and Korea. It affects these regions usually. So imagine Kawasaki's disease in a child of 4 to 5 years of age who is already genetically susceptible, and then there comes any infectious agent which can be viral in most of the cases, and that viral agent, infectious agent, actually triggers this disease. Then the T cells response against that infectious agent occurs, and that is actually an example of delayed type hypersensitivity response. There is unchecked cytokine production, and then there is polyclonal B cell activation because of cytokines, and those B cells actually produce antibodies. But these antibodies are now auto-antibodies to the vessels, to the endothelial cells of the vessels and smooth muscle cells in the vessels. Antibodies, and they precipitate this vasculitis. So in a nutshell, there is an abnormal immune response to an infectious trigger that causes Kawasaki's disease. The histological features usually resemble polyarteritis nodosa, but with a very little difference that fibrinoid necrosis is usually less prominent in the case of Kawasaki's disease. Now let's move to clinical features. The patient typically presents with a viral-like illness. There is conjunctival and oral erythema, blistering, edema of the hands and face, as you can see in the diagram, erythema of the palms and the sole, a desquamative rash, and a very important feature is there is cervical lymph node enlargement, and hence there is another name for Kawasaki's disease, which is Mucocutaneous lymph node syndrome. The treatment is usually IV immunoglobulin therapy and aspirin. Now you may wonder that if it is presenting like a viral illness, then why are we using aspirin? Aspirin is not contraindicated. With many viral illnesses, aspirin produces a side effect, which is something called Reye's syndrome. The Reye's syndrome can actually affect the brain and liver in the children, and thus aspirin is usually contraindicated in many viral illnesses. But in Kawasaki's disease, it is not contraindicated because first of all, Kawasaki presents as a viral illness, although itself it is not a viral illness. It may be triggered by a viral antigen, but it is not a viral illness, so aspirin is not contraindicated. Now next we have Verges disease, which is also known as thrombangitis obliterans. Verges disease results in severe vascular insufficiency of the extremities, which is usually in the tibial and the radial arteries. This leads to ulcer formation and gangrene and even auto-amputations of the limbs and extremities. This acute and chronic inflammation of the medium-sized and small arteries can even extend it to the adjacent veins and the nerves. Secondarily, this neural involvement is quite painful. Verges disease occurs almost exclusively in heavy tobacco smokers, and it usually develops before the age of 35 years. Cause is usually thought to be there is some the damage caused by tobacco to the endothelial cells. There is endothelial cell toxicity because of tobacco, which triggers the Buerger's disease. Whatever is the cause, the result is the gangrene, autoamputations, ulcerations of the extremities, exclusively occurring in the tobacco smokers. This is acute or chronic vasculitis, which is transmural, that is, it involves all the layers of the medium and small arteries. There can be extensive inflammation, thrombus formation, granuloma formation, and even abscesses can form. The adjacent nerve and artery can get damaged to such an extent that they can be encased in a fibrous tissue. The clinical features or manifestations are usually Raynaud's phenomena, and Raynaud's phenomena results from the exaggerated vasoconstriction of the arteries and arterioles of the extremities, usually of the fingers and toes. Here you can see the diagram for Raynaud's phenomena. Raynaud's phenomena is usually cold-induced, but there can be other causes as well. So the clinical manifestation is Raynaud's phenomena, and there is in-step foot pain. There is foot pain induced by exercise, that is in-step claudication, and also there can be phlebitis, which is inflammation of the veins. The vascular insufficiency of Buerger's disease is accompanied by severe pain even at rest, and that is because of the neural involvement which was adjacent to the arteries. And chronic ulcers can develop and gangrene can form. Actually, smoking abstinence can decrease the chance of future attacks, but the presenting or the existing lesions usually do not respond to smoking abstinence. Now next we have Wegner's granulomatosis. Wegner's granulomatosis is a vasculitis, inflammation of the vessel, which is necrotizing involving necrosis, and there is a specific triad usually found. Here is the triad. There can be granuloma of the lungs or the upper respiratory tract, and secondly there can be vasculitis, inflammation of the medium and small sized vessels of the lungs in the upper respiratory tract, and the third important point is that there is glomerulonephritis. This disease usually resembles polyarteritis nodosa, but there is an additional feature of respiratory granulomas as well. Again, there is the same, somewhat similar pathophysiology. There is some infectious or environmental insult or antigen that is inhaled, and then our cell-mediated hypersensitivity response against that antigen occurs, and the vasculitis results. The necrosis, granuloma, and inflammation of the vessel wall is also surrounded by fibroblastic proliferation. Fibroblasts accumulate, and there is fibrosis. And mind you, granuloma forms because of multi-nucleated giant cells formation. And then multiple granulomas that have formed, they actually unite together to form a visible nodules that can be seen on the lungs with central cavitations. The disease usually occurs in the middle age, and the features can be there is pneumonitis, there is nodularity and cavitations on the radiology. There is a history of chronic sinusitis, there is nasopharyngeal ulcerations, mucosal ulcerations, there is a history of renal diseases, rash, myalgia, and neuritis, fever. A very important feature for Wegner's granulomatosis is that there is C ANCA associated with the triad of Wegner's granulomatosis. The treatment is usually with steroids and rituximab.